So we're talking about a PROM. It's basically all those complications that come up in pregnancy. This is what usually abbreviated as PROM, right? Fully known as what? Premature Rupture of Membranes. So for this premature rupture of membranes, it just has to do with what? When the amniotic sac breaks before labor begins. Alright. So typically after 37 weeks of gestation, right? So labor has not begun, but amniotic sac, they have ruptured already. So they call that a broken water. Okay. So if it happens before 37 weeks, it's called a preterm PROM. So if it happens after 37 weeks, it's just a PROM. Do you understand? That's the difference between the PPROM and just the PROM. Right. So before the 37 weeks is more a serious condition. Do you understand? Because the baby is still premature by then. But after week 37, your baby is cool. Okay. So what happens in this PROM is the amniotic sac that basically ruptures. Okay. Releases fluid through the vagina. The fluid is what coming out as broken water. So it may feel like a gush or a slow leak. So often signals that labor will begin soon. Okay. So 90% of the term PROM cases will lead to labor within 24 hours. So if a woman is having a broken water, if it is at home, you have to take her close to a healthcare facility. You understand? So, causes and risk factors is what? Maybe she has had infections in the uterus, cervix, or vagina. Maybe she has been smoking, a poor mother. So maybe she has not been feeding well, multiple pregnancies, or excessive amniotic fluid. That's what? Polyhydramnios. If she has previously had this issue before, alright, cervical insufficiency or uterine abnormalities. Okay, so complications, it could lead to what? Infections. It could lead to placental abruption or umbilical cord prolapse. The umbilical cord will now reach this area. This umbilical cord will fall and block this place. That's umbilical cord prolapse. Then preterm birth and associated neonatal risk, pulmonary hypoplasia. So diagnosis, just speculum examination. Just use something to widen the vagina to observe, pH test, Fern test, ultrasound to access the fluid levels. Okay, and all that. Of course, treatment is child delivery.